Wait a minute. All right, I think we'll give it a couple minutes here for folks to join. That was a quick hustle there. All right, let me get this up. I want this one.
Again, this video, so it will be speaker view. So whoever is speaking will be what is showing other than shared screen. And that's what the audience will be seeing, the attendees.
Okay. Okay, I'm going to keep my eye on this. I think I'm watching just to see how people log on. Okay.
Just a reminder too, if you don't want to be seen, you need to keep both your audio and video off.
So I am wondering, Pam, if we go ahead and do the presentation. Okay, welcome. Let's go ahead and get started. Welcome to the session about what is titled, What is an LHCC and Why Should I Care? We'll talk a little bit about today about what this means and how everything fits together. So we've got here today, we have Jean Hill with the Salt Lake Valley Coalition to End Homelessness. We will have a video message from Heather Hogue with the Mountain Land Continuum of Care, and Stephanie Jones from the Balance of State Continuum of Care. I'm Tricia Davis with the State Homelessness Programs Office in the Department of Workforce Services. So let's start with, what is an LHCC? And a local homeless coordinating committee is a Utah-specific term where homeless services are coordinated and communication takes place within the local communities. There are 13 throughout the state. We just heard in our general session from all of the 13 local homeless coordinating committees. The LHCCs are a county or a group of counties, often aligned with the Association of Governments, but not always. LHCCs are instrumental in determining gaps, priorities, and funding for the community. And LHCC leadership is involved in coordinating service provider funding requests and making recommendations to the State Homeless Coordinating Committee. The local homeless coordinating committees were really developed around 2004 and 2005. And at the time, that was in alignment with the strategic plan for homelessness, and it was a 10-year plan to end chronic homelessness. And as you're all aware, we are continuing to work on that. The level of participation with each LHCC has varied over the last 5 years, and our office has been working hard over the last 3 to help LHCCs that had really become inactive, become active again. Participation and coordination within the LHCCs and throughout the state has increased significantly during our current pandemic, and we feel like we were getting stronger and stronger in terms of our coordination. We'll talk a little bit more about the Utah Homeless Network. Trying to figure out how to make this work. Okay, there we go. The state strategic plan, our current strategic plan was adopted by the State Homeless Coordinating Committee last year in September of 2019, and outlines 4 specific measures in alignment with working towards making homelessness rare, brief, and non-recurring. And we'll talk more as we go through this about how you fit into that picture and how the work you're doing impacts individuals and families throughout the state. In the strategic plan, the local homeless coordinating committees are the designated local oversight bodies that are responsible to develop a common agenda and vision, develop a spending plan that coordinates funding supplied to local stakeholders, and monitor the progress towards achieving state and local goals. It also, the LHCCs are also responsible to align local funding to projects that are improving outcomes and targeting specific needs within the communities. This is where you fit in. This is the work that you're doing, and it's important to understand how you fit into this puzzle. I'll pass the time over to Steph to talk more about what really the LHCC model is all about.
Thank you, Tricia. Tricia talked about the what and the when of the LHCC model, and I'm going to touch a little bit on the why. So back in 2014, our homeless system was kind of siloed. Everyone was doing great projects, but there wasn't much collaboration in communities and even sometimes in agencies themselves. So the LHCC model was developed to break the silo and include all the stakeholders, as you can see represented by, around the bubble, to do system planning on a local level is what they were developed for. So as we talk about the LHCC, think about your area and how you fit into that model. How can you fulfill the purpose that they were set up to develop and implement local homeless plans, to implement measurements and benchmarks, to prioritize and coordinate your funding, how to use HIMIS to report and manage your results, and how to develop a pathway to self-reliance for our homeless friends. And then how this system fits into the continuum of care that Jean is going to talk more about.
If I can unmute myself, I will, definitely. So the continuum of care, it was designed by HUD, it is designed by HUD to make sure, and what a continuum of care agrees to is that they will take responsibility for ending homelessness within their communities. So it's a huge role for the continuum of care, and really it is about making sure that our funding requests to HUD, to the federal government, are informed by providers and by state and local governments, and also that those requests are coordinated within those groups so that we can minimize homelessness, so we can rehouse individuals and minimize the trauma and dislocation caused to homelessness, individuals, families, and communities. And the continuum of care also promotes access to the utilization of mainstream programs and benefits. In Utah, there's 3 continuum of cares, and I know there's been some talk around communities that, wow, only 3. But really, that's what HUD asked for. They want continuum of cares to be consolidated because it is a more effective way to ensure that the money that HUD gives for homeless programs goes to homeless programs and not to administrative costs. And in Salt Lake County, our continuum of care is also our local homeless coordinating committee. That's true for mountain lands as well, but you'll see in Balance of State that there's quite a few different LHCCs in the Balance of State continuum of care. So when you see the map next, you'll might be a little afraid of that Balance of State continuum of care, but really that is the most effective way to ensure that the funding is used to rehouse individuals and not used just because we have 13 individual LHCCs seeking grant funding from HUD. We can bring those 13 into one COC and make sure that the money's spent most effectively. You want to go to that? Yeah, and there are the continuums of care. So balance of state is 11 LHCCs, 25 counties throughout the state. Mountain Land is 1 LHCC with 3 counties, and Salt Lake County is 1 LHCC that covers just the county, and you know, frankly, a vast majority of homeless services in the state. So it needs just to be that one LHCC and COC.
You're on mute.
Struggling, yep. So just to put this into context and how everything fits together as a state, we do have the State Homeless Coordinating Committee, which is currently chaired by Lieutenant Governor Cox. And we have our office, which is our State Homelessness Programs Office in Housing and Community Development, that helps support the work of the State Homeless Coordinating Committee and helps to support the local homeless coordinating committees. You can see from this, this image, and this is also in the strategic plan, that you've got your balance of state COC LHCCs, and they're all listed there, similar to the previous slide and the map that Jean just spoke of. We have Mountain Land COC, which is also the LHCC, and the Salt Lake County COC system, which is also the LHCC for that area. We have 3 different groups really that are involved on a state level. And this is where a lot of the coordination is taking place right now, is within the Utah Homeless Network. So the Utah Homeless Network, and I'll talk a little bit more about this later, really is the leadership of all of the local homeless coordinating committees. And that Utah Homeless Network has a steering committee. And we also have what's continuing to develop through this crisis response in COVID-19, more of what like we like to refer to it as almost a membership committee with the Utah Homeless Network that are currently meeting weekly with Pamela Atkinson. We've got our HMIS, that's our Homeless Management Information System Steering Committee, an allocation committee that is connected to the Utah Homeless Network and the LHCC leadership that helps make funding decisions. And then Data Leadership Committee, which is also in continued development as we kind of move forward and implement our new strategic plan. Oh, too far. Let's see here. So Steph, I wanted you to talk a little bit about this.
Okay, this is just to get try a different perspective of how the continuum of cares, the LHCCs, on all the committees kind of correlate to each other. So structurally, over everything, we have the continuum of care from HUD, that's mandated by HUD. A lot of our regulations, a lot of our best practices, things like this come from the continuum of care, and they're to be passed down to our LHCC membership who can implement them locally by LHCC committees or task groups, one circle down. And then when you get down to the core functioning that's making all this happen, it's our executive teams on our steering committees that are trying to make homelessness in Utah rare, brief, and non-reoccurring. Then we are also supported on both sides by the Utah Homeless Network that Trisha's going to talk more about, and the State Homeless Programs Office. Want me to keep going, Trisha?
Yeah, I was going to say, yeah, go ahead, Steph.
Yeah, so we talked about the model, the LHCC model, and Jean and Trisha have both talked about how it's different than the continuum of care. So if you don't live in Salt Lake, Utah, Summit, or Wasatch counties, then you belong to the next slide. You belong to one of these. And when you think about this large area and the challenges of someone being homeless in Bear Lake versus someone homeless in St. George, think about its diverse topography, its diverse communities, even the weather changes how we serve the homeless. And so how do you get involved and why should you care? Well, some of the responsibilities of the state, from the state plan are on an LHCC level, and that's a good place to start if you want to get involved. We need you to take an active role in your LHCC. It might be advocating for the homeless with your local elected leaders, or working with local law enforcement to educate and mitigate the issues within your community. Or like the opening speaker, Margot said, maybe it's just talking to your friends and family about mental health and substance abuse and how those don't prevent people from becoming successfully housed. So that's how you can become involved. And there's you can look at data and analyze data and find out where your community's gaps are. You can be involved with the point in time count each year that we always need volunteers for. And one of the most important functions of the LHCC is designating one or more of your members to be a part of the balance of state committees on the next slide. So, you know, some of the communication breakdown seems to be getting this information down to the local level. And this is how you can really step in and help gather that information and bring it home, so to speak. It's critical you think about who represents your area on these subcommittees to gather statewide information and knowledge to help your community. So you can find the names of who represent your area on the website that we'll give you later. But the committees we have are coordinated entry, which you know, it's a centrally located or centrally used system in your community where everyone enters the homeless system the same way and is assessed the same way. We have the performance and review committee that looks at the balance of state data and how communities are doing, and is a big part of how funding is looked at. We have the NOVA, which is the HUD release of funding, and making sure that we get data for that. We also have policy and compliance to help communities, you know, keep in check with all the rules and regulations, the point in time count. And then I think the really cool one is learning collaborative calls. If you're not familiar real well with a certain type of assistance and you want to implement it in your community, this is a good place to learn and collaborate about the different resources out there. And next slide. So I want to introduce Heather Hogue. She's the collaborative applicant for the Mountain Lands Continuous Care, and she's so great that we had to have her in 2 sessions. So we're going to get the video version of Heather in our session.
Hi all, this is Heather Hogue. I'm with the Mountain Land Continuum of Care. That is Utah County, Summit County, and Wasatch County. I'm going to tell you a little bit about our structure of our COC and how we operate and what our subcommittees look like, and then also how you can get involved with our subcommittees if you're in those areas. So as you can see from our little bubble thing, the Mountain Land COC has several different work groups or subcommittees that operate. So if you start at the top bubble, our Coordinated Supportive Services Subcommittee is also our by name list committee. This is comprised of a lot of frontline staff, and this is where we pull our housing list. We talk about our SPDAT scores, we talk about our vulnerability, and we talk about our clients, our homeless individuals by name. This is also a committee that comes together to make placement recommendations for permanent supportive housing, and we meet together every other week, and we also do some trainings on occasion in that meeting. We're about to have more. If you go clockwise, our executive committee is comprised of a few individuals that sort of make the overarching decisions of what's going on with our COC. and lead the meetings. Also, this executive committee approves requests to our Housing First Fund. The Housing First Fund is this big pot of money that we've got that we can use for random things to get people into housing, like if they can't get a birth certificate from out of state, or if they can't afford to pay past due utilities, things like that. If you keep going clockwise, our Rank and Review Committee is a committee that comes together whenever we've got to rank projects for state or federal funding. Particularly the NOFA, which is the big federal grant that comes down once a year. This Rank and Review Committee meets around that time and helps determine the priority of the projects that we have that applied for money. Next on the wheel is our Public Relations Committee. We meet once a month, and this is how to educate people about homelessness. So we have an article in the Daily Herald that comes in about once a month, if they remember to run it. We also talk about things like Affordable Housing Week or other events where we can get the community involved and really sort of educate people about homelessness. They also help me with social media and our website. If you scroll down a little more, at the 6 o'clock position, our Youth and Education Subcommittee, we formed that originally a couple of years ago to look at funding for youth-centered homelessness projects. This is kind of an ad hoc committee that we do kind of as needed basis, but talks about how to address specifically the needs of homeless youth in our community. Scrolling back up, our Discharge Committee, we meet quarterly, and this talks about how to coordinate with law enforcement, jail, prison, and hospital discharges, so that we don't have somebody discharged to the street without anybody looking after them. You know, a couple of years ago, we had a guy come out from a mental health hospital, and they discharged him in the middle of January. It was 15 degrees outside, and he had shorts and a t-shirt and sandals. This discharge committee is sort of determined to make sure that that doesn't happen again. So we have a lot of buy-in with institutionalized settings to make sure that we're sending the best things out there. Our point in time committee, we usually start in November, and we talk about how do we cover our area, who are our team leads, how are our volunteers going, where are our hot spots. If y'all are frontline staff, probably you've been on my point in time account committee. And if not, I'm gonna nab you for 1 year, I'm sure of it. If you zip up to the last one, our Housing Solutions Work Group, this is comprised of realtors, landlords, city officials. The idea behind this work group is how can we come up with unique solutions for our community that deal with affordable housing. This is kind of an ad hoc committee as well and meets whenever necessary. But we look for, can we get tax credit projects in? Is that a motivation for builders? What is a motivation for builders if that isn't? How can we combat this NIMBY thing, the not in my backyard thing? And so this is a group that kind of really gets crap done, which I really like. So those are the subcommittees for the Mountain Land Continuum of Care. And if there is a subcommittee that I just described that seems like it fits into your interest or your job, we take all comers. Lots of voices makes for good conversation. So if you have questions, contact me. My contact information is going to be on a page, but it's heatherh@unitedwayuc.org. Y'all probably know me. And we'll get you on a subcommittee and we'll put you to work. Thanks.
All right. So thank you to Heather for creating that video. I'm learning my technical stuff, and we're all doing this baptism by fire, aren't we? So let's go ahead and we'll move on to the Salt Lake Valley Coalition.
Thanks, Tricia. So the Salt Lake Valley Coalition, again, we are the Continuum of Care and the local homeless coordinating committee, and we have gone through a significant change in how we are structured over the course of the last couple of years. So the coalition itself came formally into being last April. So we're new, but we're, I think, much more effective than we were originally. Our COC was a good COC, but we were missing a lot of the key partners in what we were doing. So we decided that we would change what we were doing. And a lot of that was based on Salt Lake County Mayor at that time, Ben McAdams, had pulled together a group a large group that was looking at how do we better structure what we're doing, how do we better serve. So what we came up with in our COC was we really have some core functions in addressing homelessness. So we created these core function groups, which are our little bubbles, to feed into our steering committee to make better decisions, but also to ensure we're coordinating across those functions. So you can see the core functions that we came up with there. There's a health and wellness core function group, housing, crisis response, which is really, you know, the shelter services, dealing with unsheltered, how do we handle COVID, education, knowing that we have homeless individuals in our schools, knowing that we have homeless individuals at the universities, and we have a need for education for a lot of clients who might be able to get better paying employment to continue to afford housing if we can help them access education. Employment is obviously key. Community engagement to make sure that we're hearing the voices of those around our resource centers, around our service providers, that they feel a part of serving the homeless, but also feel listened to. Legal rights and safety to make sure not only that we're looking at public safety, but also that the rights of our homeless clients are being addressed as well and not being undermined. And then a client-focused core function group that is the opportunity, best opportunity, not the only opportunity, to have client voices impact what we're doing and how we serve people. If you go to the next slide, and so where is your voice needed? Where can you come in? There are lots and lots of opportunities to impact what we're doing in Salt Lake County. Each of those blue boxes, which you may or may not be able to read what's in them, but each of those are task groups that feed into the green boxes, which are those core function groups I just mentioned. And that the decisions that, or the conversations happening in those core function groups feed up to our steering committee, which is made up of the heads of each of those core function groups. So we have a 16-member steering committee, and each of the core function groups has 2 leads, and those 2 leads make up that steering committee. So within those boxes are a lot of different places to get involved, depending on what your interests are, depending on what your expertise is, and where you most want to make a difference. You can see, and I can't see them because my eyes are old, but like in the client focus, we have a focus on those who are aging. We have a focus on families and veterans and LGBTQ and different client groups and youth that can feed into that client focus group and let us know how each of those different demographics, if you will, are being impacted, what they're seeing as their needs, how they're not being served, so we know what the gaps are there. And each of those core function groups has a number of different task groups where you can definitely get involved. Just to get a sense of what each of those groups do, in housing, they're looking at right now having an ongoing housing inventory, making sure that we're not losing low-income housing and that we're able to work positively with landlords. Employment group is really working to make sure there's training for employment. There's also job training opportunities within our HRCs. Crisis response is implementing and evaluating our coordinated entry standards, ensuring that accurate HIMSS reporting that's so vital to ensure that we're getting what we need out of HIMSS and be able to get the funding we need as well. Health and wellness is looking at all the services, what are the gaps, what are the best practices. Legal rights and safety, we're really focused right now on stopping that jail to homelessness cycle and ensuring the best and consistent practices across police jurisdictions. Community engagement is trying to raise public awareness, make sure we're addressing the myths about homelessness, getting accurate data to address public perceptions of homelessness. And the client focus, again, really just wants to make sure clients have a strong voice in what we're doing. And then education is looking at best practices to address barriers, identify education opportunities, and determine those educational needs for our clients. So you are welcome to join any of those, and we'll have our website where you can find out when meetings are for each of these core function groups and get engaged.
Great. Thanks, Jean. So I wanted to talk a little bit more, we have mentioned this, about the Utah Homeless Network, and if you were in the general session, there was a lot of mention of the Utah Homeless Network. So I wanted to give you a little bit more about that. Again, the Utah Homeless Network was created to have better coordination around the state. As you know, the state office that really supports a lot of this work and a lot of the funding, we wanted to make sure that there was a forum that everyone could be heard from around the state, and that also the local homeless coordinating committees were able to really understand what the different issues are happening around the state. And I mentioned a weekly meeting that we're having in response to COVID-19 that is co-hosted with Pamela Atkinson and myself. And I think that's been a group that's really come together to, again, understand what the different issues are, share different ideas and different resources to connect with. And so that will continue as we move through this work and the further development of the Utah Homeless Network. This is going to be an experiment. We'll see if this works really quick. Jean and Stephanie and Heather all mentioned ways to get involved. Tell me if you can see this website. Yeah? Okay. So this is the best place to go for all of this information that we're talking about today. You can see the Balance of State has a page. Mountain Land has a page that also connects to another site that they utilize more often for information sharing. And then as Jean mentioned, all of the different kind of core function groups and committees that are available to participate in Salt Lake Valley. You can see there's a calendar here, and you can see the different meetings that are taking place. I guess my pitch really to get connected, if you're working in the Salt Lake Valley, would be to go to this website and connect there. We'll talk more. Heather mentioned, we'll give you her contact information. And then for the Balance of State, Steph, I don't know if there's anything you want to add, but there's also a calendar here for the different meetings that are taking place throughout the Balance of State and the 11 local homeless coordinating committees that are in the state, in that area. Anything anyone wants to add to that, Jean or Steph? Okay. All right, so let's go ahead and we'll go to this. So we really want to make connections in this workshop about how you're involved. What does it mean for you? We talk a lot about data. There was data presented in the opening session. We'll look at that a little bit more in this session as well. But the question is, how do you, as a service provider, and at different levels, if you're in leadership or administration, how do you help homelessness be rare, brief, and non-recurring? The main way that we do this through a data perspective and data lens right now is through the HUD system performance measures. This is a graphic that also can be found in the state strategic plan. And I like this one a lot because I'm a visual person, but you can see really the different ways and the different ways that we need to push these performance measures. We want job and income growth for homeless persons to increase, the number of homeless persons total to decrease. I won't go through all of them, but I think as a service provider, if you are functioning in that role and you're helping individuals and families on a daily basis, you'll be thinking about how you fit into this puzzle when we're looking at HUD system performance measures. Let me go on here. Jean and Steph, did you want to add anything on this slide just from your perspectives with the LHCCs?
Just quickly to say, we use part of our whole change in structure as well was to make sure that everything we're doing is data informed. So the data that frontline workers are inputting is critical for our funding decisions. It's critical for how we identify our gaps and performance, and it's critical to our advocacy efforts on the state and local levels. So the work that you're doing makes a huge difference. And I just want to give a shout out, for example, just in the income growth for homeless persons, job and income growth, our Gail Miller Resource Center got 728 people job placements in the last year. So, that's a critical piece of that performance measure. And if we don't have accurate data, we can't make accurate pleas to those who will be funding our work.
And Tricia, I would just add also that with the balance of state being so large, data becomes really critical to see trends in the areas, to fill your gaps, and to recommend funding. But also HUD looks at this data on a balance of state level. And it's critical that all areas are entering good, reliable data, because we often say we're only as strong as our weakest link, right? And so if we have an area in the balance of state that's clear down south, it's still affecting the north or vice versa. And so it hurts all of us if we're not doing good data.
Of course, I shouldn't have muted. It's the dreaded mute button. Thanks, Steph. Thank you, Jean. Steph, I think we've got you on this next slide if you want to talk a little bit more about the data that people are collecting.
Sure. Because we know we ask for a lot of data to be entered, right? And depending on the program and the funding source, you might be entering it into 2 databases. But the HOMELESS data entry, it's required for these programs that we're going to talk about: the emergency shelter program, the activities surrounding temporary shelter, from homelessness. And they're so diverse. It goes from like the Gail Miller Center to the hotel motel voucher in Uinta Basin. Those are all types of emergency shelter. The next is homeless prevention. And right now, many of you probably are familiar with the programs that are going on. And I'm gonna use a term, the RAP-O-CRAP programs that you're entering, right? We know you're swamped, and we want to be able to show your work and all the work you're doing during this pandemic. And so we need that data to tell a story. And then there's next, rapid rehousing. This is quickly getting people back into housing. Street outreach, finding and connecting people to emergency shelter, housing, and critical health services. And the next slide. An example of data being great and how it's been used is Diversion's received a lot of funding lately. And this is keeping people from entering the homeless system. And because the data showed that the funders, that these activities that catch people and keep them out of the homeless system were more effective and more beneficial to self-sufficiency, that keeping it rare part, this frees up resources for the homeless that need more intensive programs, like the permanent supportive housing for people with disabilities, or the single room occupancy for individuals, or transitional housing for specific populations. So that is important. Because, and you know, it's important because it supports the next slide. And that's a systemic connection to the service that best meets the need of the client. When all programs are centralized and coordinated, the data collected during intake and assessment helps your program and your community. But most importantly, it helps the veterans. It helps the minimum wage single mother of 3 during a pandemic. It helps the people who have experienced emotional and physical trauma. In total, it serves those most vulnerable among us. And I believe that that's why most of us are here.
Oh, too far. Thanks, Steph. So Jonathan mentioned in the general session as well, the annual report on homelessness. This is our 2020 report. And the challenging thing with this report, and we know what the challenges are, is that our data is reported on a federal level by the federal fiscal year. So the data that we've got in this report is through September 30th, 2019. It's important, I think, just in relation to the last slide, and Steph, thank you for talking about that, is really thinking about the connections that each program has to each other, right? If you are working in street outreach and you help get somebody off the street into emergency shelter, that is a great positive outcome for street outreach, for example. What that does is that it impacts data for the emergency shelter, right? But it's really about this continual flow that we're talking about as a leadership group, and how systems need to flow from street outreach to emergency shelter and then out into permanent supportive housing or housing. So we're going to look a little bit, just a little bit briefly at the data, the main points of data in the report. The first measure that we report to HUD, and this is all related to that wheel, that colorful wheel of the performance measures that we showed earlier. Measure 1 looks at the length of time persons remain homeless. This is pretty steady for us, but as Jonathan mentioned in the general session, you know, we really want to see this measure and the number going down, but everything, all of these system performance measures impact each other in some way. Steph, I'll pass this to you.
Sure. This measure 2 is the extent to which persons who exited homelessness to permanent supportive housing destinations, how many of them returned? So this is our non-reoccurring section of the goal, right? We use this data to look at which programs are effective at making sure that people don't return to homelessness. And it has shown that we are doing a good job. We're actually going down on this measure, which is some we want to go up, right? And some we want to go down. And this is the one we want. It's trending the right way.
And here is another one that's trending the right way, we hope at least, and that is number 3, which is the number of homeless persons. And that is people enrolled in emergency shelter and transitional housing during this period. So that number is also trending down, which is good news. Although we have to acknowledge that the definition of homelessness also varies across agencies. So, you know, our education standard is a little different definition that covers more people. So there may be some play in these numbers.
And this next one, this measure 4 is employment and income growth for homeless persons in COC funded projects. The interesting thing is as we talked about this as a group, with this data point is, and we cannot say this for sure, but in looking at the data, we wonder if this kind of the fluctuation here that you see is about the data that was entered. And it's been mentioned already, but our reporting is only as good as the data that's entered into the system. And we wonder if this, if you see on this graph, if that has something to do with this measure in the way that it's reported, and really a plug, you know, to all of you as service providers to be, you know, entering high quality data so that we can be reporting information as accurately as possible to our federal partners in the state.
Measure number 5, number of persons who become homeless for the first time. And this is something we might use to look at how well our diversion services are working to make homelessness rare, right? We would probably look at measure 5. Now you'll notice that we skipped measure number 6. It's not listed in the strategic plan. That one is homeless prevention and housing placement for persons. And it was designated by HUD for continuum of cares that are high performing communities. And the bad news is no community is there yet. The good news is we're trying to get there.
And the really good news is how successful we are once we get people housed. We have remained very consistent at 93% of people staying in their housing once they've exited to a permanent housing destination. And that's something we as a state really should celebrate and, you know, move that number up. But it's fantastic how well we're doing on keeping people in those housing placements. So why should you care about all of this? Well, because the LHCC is where you have a voice and can really help with decision making and creating policy. It's where you can engage to make a real difference for the people that you're serving. And just as an example of that, we had a example from, I think it was from Mountain Lands, where there was some problem making sure that people who were veterans were designated as such when they were entered into HIMAS. And so those folks weren't getting the access to a lot of resources that are available for veterans. So it really is an opportunity to make a huge difference. Once that was identified and recognized and people started really making sure they were getting that designation into the system, those people who were veterans were definitely having much more positive outcomes because they were then properly resourced to get them into housing and help them retain that housing. It's also important for funding for homeless staff and services. Data and data quality matters. And that's, you know, bottom line is it really matters for making sure we're able to sustain and improve these programs. Data also helps us combat those myths about homelessness with the public and public officials. And that's critical if we want to ensure funding levels are appropriate for that portion that comes from government sources. And we know homelessness has no boundaries. So ending homelessness can't be done in isolation. We must work together, and we need your voice in order to make sure that we're doing that effectively. And we would just want to thank all of you who are frontline staff for all of the incredible work that you do. It's been amazing what's gone on, especially, you know, I can only speak to Salt Lake County, but the work that's been done in Salt Lake County these past 2 years, but since the HRC's opened specifically, is just unbelievable. So I'm just going to give a shout out to our HRCs right now, because really we have served 3,549 people since the HRC's opened. And of those, 247 have exited to housing, 346 were diverted from shelter, and as I said, 728 got job placements. And with COVID, we have to recognize in Salt Lake County, the number of positive COVID cases within our homeless population has remained consistently under 2%, which is phenomenal, and that is because of the work of the frontline care staff. Stephanie, you got someone to thank.
Yes, we have so many great people across the state of Utah, and they are really evident in our rural communities. They're pulling this enormous weight, and they're doing it to help the people of their communities. And then we also have bigger communities, Ogden, that are also doing a great job. And I know the COVID-19 has brought on so many more challenges, but when we look at the benefits, we really are connecting more now to these far off. We got Mac in San Juan that we get to see now. We get to hear the alarm that goes off in his community, and we get to know more about him. So we can look at the positives that have come out of this and really be grateful to all our staff and our service providers.
5 minutes remaining.
Thank you. Our next slide.
And we do want to give you a call to action. Don't leave this session without, you know, thinking you're done here. This is our call to action for everyone who is listening right now and those who will watch it later as it's recorded. Please, 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 please get involved. Your impact is huge on this system because you are the people on the front lines. You are hearing the stories. You are seeing where those gaps hit the road and where people are falling through the cracks. So you are critical to what we're doing. Also, your data is critical to what we're doing. So please make sure, you know, you're getting the training you need on data and entering that correctly. And please reach out if you have questions and ask if you need help. And Tricia will give you some more information about all the different places you can go to for help. But together we will make homelessness brief, rare, and non-recurring.
Thanks, Jean. Yep, as a reminder, if you are interested in getting involved, you've got some websites here and contact information. Those websites for Balance of State and Salt Lake look a little messy, but if you go to End Utah Homelessness, as I showed you before, endutahhomelessness.org, you will be able to figure out who and how you can connect. If you are interested in participating in the Utah Homeless Network meetings that we have weekly right now, please feel free to email me or Stephanie Leeds, and we will get you on that appointment notification. We have just a couple minutes if there's any questions from attendees.
Yeah, we have.
Go ahead.
Sorry.
Hi.
Hi, Tim.
Hi. One of the things I heard in the presentation, I think it was from Jean, that 728 people were employed. I want to know, and that's from the data that you guys were referring to. Is there a way to drill down into that data to find out, okay, where were they employed? Did it result in housing?
Good, that's a great question, Tim. And first, let me clarify too, that 728 was just from the Gail Miller Resource Center.
I know
was
that, yeah.
through their job fairs, yeah.
Yeah, I'd heard that.
So whether, and I will ask Tricia on, in terms of how far down into HIMIS you can drill down, but certainly Gail Miller would have that information about where those employment opportunities came up. And a lot of that was through the job fairs that they did. So they know those employers who show up for their job fairs. So I'm sure that, yes, that information can be looked at. And we didn't do it for this presentation, but that information is available.
It just seems like a lot of jobs for a year out of one facility. And I'm just concerned about the data being presented if it's sustainable.
Well, and I will say, and again, this is anecdotal and just for me, but I know at Wiegand, when we've done the job fairs at the Wiegand Day Resource Center, it really is phenomenal what happens at those job fairs. So, again, I'm just giving you anecdotes, not the data at this point.
Okay.
But
Okay.
it does.
And I'm all for the anecdotes, kind of going back to Dr. Kushel. The story has to support the data.
Yeah.
And I would just recommend Tim also getting involved in that employment, I can't remember, Jean, the name
Employment
of
Core
it.
Function Group.
Employment Core Function. Loggins Merrill, who's with the Department of Workforce Services, is one of the co-chairs of that group. And your question just made me think about workforce services data that we might be able to connect with, to kind of look at that a little bit more as well.
Yeah. Thank you.
Yeah. All right, we have about 1 more minute. Are there any other questions? Got a couple more.
Clint Cottom, you should be able to speak now.
Okay, just a quick question. How do LHCC systems interact with other systems such as Health and Human Services, the Department of Human Services Systems of Cares, or Department of Workforce Services like American Job Centers, the WIOA systems?
That's a good question, Clint. I'll take a quick shot at it and then let Jean and Steph type in. So if you remember from that LHCC model graphic that we have, it really is about those key partners and those key players being involved in the LHCC. So Department of Human Services and the local leaders that are involved throughout the state, in specific areas, Department of Health, those are key players that we recommend be at the table within the LHCC model. Jean, Steph, is there anything you'd want to add?
I would add, Clint, that this on the LHCC level is where we develop that warm handoff system, right? This is where we get to know the people that we're going to hand off our clients to.
We can, hopefully that helps, Clint. Maybe take one more quick question.
Actually, sorry,
Okay.
Trish, we're gonna need to close.
Okay, sorry about that. If you have more questions, please feel free to reach out to us. I'll put this slide up. Pam, if we can just leave it up for a second before we end. And please feel free to reach out and we will help answer any questions. Thank you so much for all of your hard work. Y'all are amazing.